So yeah, if you wouldn't mind kicking us off by telling us who you are and what it is you do.
Sure. So my name is Kate Workman. I am a veterinarian in North Carolina, Central North Carolina, and I'm the owner of Denali Equine. I'm a co-founder of Rexos, which is our nonprofit, and we are a clinic that specializes in complicated body lameness cases, dangerous and behavioral horses, things like that, kind of outside the box. We don't do any limb lameness or generic sports medicine here.
Interesting. What is a complicated body lameness?
So people will call, this is an everyday occurrence for us. People call and go, "You will never believe the story of my horse." And I go, "Okay, tell me about it." So they have a lameness that comes and goes, or it's only under saddle, or they explode and buck under saddle, but it's perfectly sound and they don't know. And it had blocking exams, and it had a bone scan, and it had neck x-rays, and it doesn't have kissing spines, and we have no idea what to do.
Hmm.
Um, that is kind of where we end. So conventional sports medicine tends to do a really good job until a blocking exam doesn't block out a lameness or a behavior problem. And then you're left with now what? And so that's pretty much what we get: brachial plexus injuries, complicated fractured backs, fractured ribs, fractured sternums, things like that, that don't really fit in a classical diagnostic bubble. And so that's really where we focus our energy on, is things that people might not think is all that common: shoulder injuries, thoracic sling injuries, pelvic and groin injuries. And that's kind of the hallmark of kind of the bulk of our caseload.
And
I got into treating shivers and string halt horses using getting up with Dr. Audrey DeClue. And so we see a fair amount of shivers horses as well here.
hmm, interesting. So how common are these types of injuries that you're seeing?
So I think all horses have them, period. Because we have to understand that a horse is an athlete, and any professional human athlete has injuries.
Mhm.
Now, whether they are clinically significant to the horse and its job or not is where the spectrum deviates.
Mm.
So if you're a high performance jumper or dressage horse, the degree of your body lameness acceptability might be different than if you just trail ride with your owner, right? And that's where I think the spectrum is. And the lameness can range in that my past ornament that my husband or I or my children trail ride, what I accept as sound for that horse is very different than what I would expect from a Grand Prix type
Mm.
horse. And career specific injuries, what I expect from a Western horse is very different than from an English horse. And so I think all horses struggle with body lameness because your body hurts you sometimes, right? I've never met an adult that doesn't say, "Hey, sometimes I have this problem." It's when you cannot functionally do your job, or when you are overtly painful,
Mm.
and your quality of life is problematic, that I think we really have to step in on any horse, regardless of their job.
And once a horse is brought to you for this odd lameness thing, what does the process look like until you've kind of diagnosed them with something?
Sure. So horses come. Everybody always asks, "What are you going to do? Why is it going to be different there than
Mhm.
all these other veterinarians I've been to?" And the simple truth about it is a physical exam. That unfortunately, I don't think physical exams are as appreciated as they once were, because we have lots of diagnostic tools, right?
Mm.
We have increased our diagnostic capabilities tremendously, and so we haven't gone back to just pure physical exams. So paying attention to really subtle nuances of asymmetries in the body, loading different feet differently, how the feet technically look and what the farrier work looks like, and then specific palpation and paying attention to the horse. So we videotape every exam that's done here, because I go back and rewatch them. Because if I palpate C2 and the horse flinches up front or rolls its eye for a second, that's actually a pain response
Mm.
that maybe somebody didn't realize.
Mhm.
Or when I palpate their neck, they have fasciculations and muscle spasms along their back. That's a painful clinical correlation. And so it's picking up on those pins its ears at you when you're just grazing its skin. That's actually pain, especially in a horse that is a riding horse or has been dealt with its whole life. And so it's really picking up on those things. Range of motion is really important to me. Does one scapula move more than the other one? Things like that. And then we take them out and lunge them. So I lunge them, free lunge them, because I want to see what they have. And I'm looking for slight differences of symmetry, of movement patterns, and I note those. And then we might put equipment on. We might just tie a rope around them. We might do a full saddle. We might have the rider ride them. It just depends on what is going on with the horse. And then notice, because if it's not lame without a saddle, then I add a saddle and it's lame. It's a huge clinical clue of where we need to start diving. And then I use my ultrasound a lot because you can't, unfortunately, image a lot of a horse in x-rays, especially over their ribs and their sternums and things like that. And so I use my ultrasound significantly more than anything else.
Interesting. And so people are right and left-handed, and we've always, or at least I've always been under the assumption horses are kind of the same. They're going to have one side that's inherently stronger than the other side. What is the difference between a horse that's just stronger on one side versus asymmetry?
So I would argue a horse in proper training shouldn't have an uneven side, right? That the left lead should not be significantly better than the right lead. Something has gone wrong. They might, especially early on in training, absolutely. When you're first breaking a horse, they might be more comfortable on one lead than the other. And that I would think is their innate patterns that they have set up from when they're foals, right? From the first few times they graze or chew, or those body patterns have been set in place. But proper training should bring symmetry to the horse. And with my professional trainers and clients, that is where I start to intervene when they go, the left lead is significantly better than the right. The right, they won't yield their shoulder. They feel stuck in the rib cage. And no matter what I've done in training, I'm not making progress. That's really the mark for me, is that in training, you should constantly be making progress, and it shouldn't be extraordinarily difficult for a horse. But if a trainer can go, for months, I've been working on that right rib cage softening to my leg and I cannot get it, there's a reason you can't get that.
Interesting. And as someone looking into a rider's program, are there things you're seeing as a almost trend that riders are doing that's either helping the horse? Like, okay, I see a lot of horses that this person gets it, maybe thoroughbreds or whatever. They seem to have a lot of luck really strengthening them on both sides evenly. Or is there something you're seeing? Okay, I see a lot of right-handed riders that are just always holding on to that right rein, and the horse can't, come through evenly because of, XYZ.
So yes, I think where I will always be limited as a veterinarian is the fact that this is a team sport. And my profession, and so that the rider's effect, the tack effect, right? If you always have a right restricted hip, well, your horse has to compensate for that. That will be part of it. The other thing that I think particularly programs struggle with is what type of horse do you have and what were your expectations for them? Thoroughbreds are the classic problem for me. I hate seeing off the track thoroughbreds. Not because I can't appreciate a thoroughbred, but that there is this misnomer that you got this off the track thoroughbred and you're retraining it for its future life. And there is no appreciation of a high performance athlete at a juvenile stage, and the damage done to its body at that time is done. It's the equivalent of if you were a gymnast, right? You peak at 17 and 18. Well, by 30, you're not the level that you were. And you now have lifelong problems because of your choice. Racehorses are the exact same way. The damage that was done is yearlings and 2-year-olds in race training with ill-fitting saddles and being asked to run at high velocity without the orthopedic development, without the strength development. That has consistent consequences on their body.
Mm.
And that is just what it is. And that's a big struggle I have. Out of all of the industries or all of the breeds and disciplines of horses, I think off the track thoroughbreds are the hardest because they tend to go to the average owner home. They tend to be middle of the road horses. And unfortunately, sometimes they have significant damage to their bodies that maybe these owners wanting to pleasure ride this horse are not aware that that's even a possibility because they're not lame. And so that industry probably mostly, I would say, contributes a standard problem. Now, all the other industries have their own nuances. Jumping horses have really bad thoracic slings. That damage is, right, the repetitive landing causes damage over time, whereas a Western horse, you don't have that. And so they do have kind of individual nuances. But I think always rushing a young athlete creates a lot of long-term problems that we don't really appreciate.
Yeah, that's an interesting analogy, the thoroughbred to the young gymnast, because I was just listening to a human podcast, and someone was talking about kids doing sports, and they were like, there's this thing where when kids do sports like football, up to a certain age, they're not allowed to tackle because we now know CTE and head injuries. But there's also this thing where when kids start running and being active at a young age, it does build up their tendons and ligaments and bone strength. Would that be the same as a horse kind of just working at a young age versus like where race training is so intense?
Yeah. Well, and there's a really interesting program in Florida for I actually met a parent of one of these kids, is how I know about this, but it's a baseball training camp for really kind of extraordinary children in baseball. And for pitchers, because they have so many shoulder problems in their 20s from throwing. And that they have done the data analysis, and we should always learn from human sports because they know way more than we do in the horse world. But they know from data analysis that it's not actually asking the children to throw fast pitch baseballs at a young age. It's that they throw them inappropriately for too long. And that they're actually training these kids that if they have the correct biomechanics through the throw, that they actually don't get the long-term damage. It's that they end up in, wreck baseball and nobody corrects their form for years and years. And then the damage is already done. So I think that's really it with the thoroughbreds, that number one, they're not capable of running correctly at that velocity at that age anyway, but that if the biomechanics and the training were correct, maybe we wouldn't have the long-term problems, but because they do not have the development and the strength to do what they're being asked to do, then that happens. Because there's actually pretty interesting human data on young athletes. And like you said, if you are an athlete and you, from an early age, even not super competitively run soccer, your body develops like a soccer player. Whereas if you play ice hockey, it develops as an ice hockey player, and you can get some differences there. Which is why I always go back to human athletics, because I think they're amazing. If you try out for the NFL, they run you through kinematics and know to the percentage of every injury you will ever have because they have all the data, and we are just light years behind in horses for that.
And what are correct biomechanics for a sport horse?
Yeah. It depends on what you want them to do. I think foundationally biomechanics are biomechanics, and there's been some trends of changing kind of our concept of biomechanics, and I think time will depend. But for me professionally, and the way I can treat these horses is they have to have functional hind ends before anything else occurs. And there has been this huge movement with the thoracic sling and what I call the shoulder girdle, because I encompass more into it, but that if they have a dysfunctional thoracic sling, they can't have a functional anything else in their body. And I just disagree with that, because for me, if a horse can't, I go back to riding them. If a horse can't rock back on its haunches for you, you've lost everything else. If they cannot sit back and flex their lumbosacral joint and sit back for you and lift their front end underneath of you, you can't get anywhere.
Yep.
And so when I fix horses and work on horses, I fix them in biomechanical sections. So I don't believe horses have a singular SI problem. I don't think that exists because the SI is too interconnected with all the tensegrity of the whole pelvis and all of the epaxial and hypaxial muscles. Like the body works as a functional unit, not an independent structure. And when you deal with body lameness, you can't have independent problems. And that's what's hard for people when I talk about diagnosing these horses is a lot of times I can't give you a specific diagnosis because I can't image their discs and I can't see all of their nerve roots and I can't get to it, but I can know that this region is dysfunctional. And so we have to fix the whole region. Whereas if you have a dysfunctional fetlock, I can just inject the fetlock. But if you have a dysfunctional lumbosacral region, there is a lot that works with each other, connects with each other, and everything in the body, has to work in harmony and it has to work in balance. And so if one side gets constricted and tense, the other side has to lax. It has to. And so it's about rebalancing and reshifting them. But for biomechanics, for me, they always have to sit back first and then lift with the thoracic sling. And I've tried to play with fixing horses' front ends first and working on them, and I don't get very far. They'll improve for a few weeks and then fall right back, and improve for a few weeks and fall right back, unless I fix and really make sure the hind end is very strong. And so that's a big thing for me. They have to sit back and lift their backs. If they cannot do that, you can't pass go.
So if I have this thoroughbred right now, and very athletic, very cool. She was a war horse, and so impeccable race record. And it's hilarious because she's like the anti-thoroughbred. So we're like, I can't believe she made it this far on the track. But her feet are a mess. How?
Yeah.
What are you noticing anything in terms of, there's that quote, no hoof, no horse. Are there certain hoof problems that are leading to, we might think they have an inflamed SI, but it's really the angle of their foot? Like, how connected is that?
Yeah. So again, everything is connected, right? And where clinically it becomes significant depends on each case. So I will use negative hind palmar angles as my example because it's all the rage. If your horse has significantly negative hind palmar angles and mismanaged feet, it will have lumbosacral, SI, and back problems, period. Because the way it puts strain, they get proximal suspensories, it all works up and becomes painful. The negative hind palmar angles have to be addressed. However, the caveat to that being is if you have reasonable farrier work, if you have a very good farrier and you're starting to struggle with negative hind palmar angles and you don't normally do that with your farrier, or it's not a new horse that you're correcting, it's a horse that was fine and now is not fine, you have a body issue that's now causing the foot problem, that maybe their lower back hurts them. And so they park out a little bit more. And the more they park out, the more they strain those suspensories, the more they put pressure on the heel, the more the angle drops. And so it becomes this vicious cycle. I will say, because I'm married to a farrier, that he will say that the more I kind of cultivated fixing the body, the feet follow. And that he believes that the feet are replications of the body, pending proper nutrition, reasonable farrier work, right? Like that all the parameters, conformation isn't terrible, all of those parameters, that if you have a truly distorted foot, you likely have something wrong in the body. And when you fix the body, then the foot just evens out.
Interesting.
But again, there's always going to be caveats to that. Thoroughbreds have bad feet. they have bad walls, they have, right,
Hmm.
irregardless of what's going on in their body, that's just part of their genetics, in the same way that a quarter horse is going to have a clubby tall foot with navicular, no matter what you do, because we've bred that into them.
Interesting.
And so each breed and each discipline kind of depends. And what is normal for one is not normal for another.
Hmm.
And but they are interconnected, and you do kind of have to take a step back and go, okay, well, which is the most offensive at the current moment? And I'm going to start with that one and then go from there. Like if I look at the feet and go, whew, we really have to address the feet. The feet need to be addressed. We'll see what we get, and then we'll work on farther. And I do the flip flop. If the feet don't look terrible, but they kind of feel like they're struggling with them, then I'm going to start with the body and watch the feet come along. Mm. But it just depends. But negative hind palmar angles are always my go-to for that, because for so long we decided feet are models of the horse, right? It shows their nutrition, it shows their stress level, it shows you a growth pattern throughout what's been going on in their life. And then all of a sudden we decided that the body doesn't cause the feet to distort. And it actually does. Like they get flares because the way they stand, they might stand too narrow, so they get these big flares. Why are they standing narrow? We need to work on that instead of the feet.
So standing narrow, some would say that's a conformation fault. I
don't think it is. I mean, there's always extremes, right? And if it really toes out because it was born that way and its cannon bones are on crooked and all of that, it does. But if you have a horse, and this is why I always find monitoring them is important. If you have a horse that used to stand really square and now all of a sudden it's doing this, something's changed. Or if you have a horse that you could go back a year and take photos of, they actually did used to stand farther apart than they currently do. And that's why I always tell horse owners to take pictures of your horse all the time. And we do with the rehabs here, we take photos of them every month, because it's about the change in pattern that I really care about. If they've always done well and they always stand narrow and it is never changing, then I'm less concerned about it than if you go, my horse is now parking out. They now sit on buckets. They now always rest the right hind. Those are clues that something's changed versus what were they born with.
Interesting. And what does I swear 2023, I tell everyone it was the year of like uneven horses. I got numerous horses into my program that were like you could stand behind on a thing and look, and one side was muscled different than the other side. What what are we seeing in this asymmetry, this unevenness?
So we can take scapulas is a good example, right? So if you stand behind your horse on a bucket and look down their spine towards their head, a horse should have two symmetrical scapulas. They should be equal distance from the spine. They should be equally muscled. What ends up happening is one moves closer and the body, again, has to stay in balance. If this one moves closer, this one has no choice but to come out, right? So because it's all about balance. And so if I get injured on my right shoulder, I do this. Right? If I do this for long enough, I go here. And so that's what horses end up doing. And what ends up happening is the bulged wide shoulder also has the low foot always. It has the low foot. The compressed shoulder has the tall foot. And then the low foot gets a DDFT and people go, oh my gosh, it has a tendon problem. Well, it actually had a scapular problem probably a year plus ago. And that because for a year, nobody noticed that this one was in and this one was bulged, which means this foot bears more weight every single step. And that adds up and the foot gets lower and the tendon breaks down and then you have a problem. And so that's what I try and really focus on is that if you have an athlete, you don't want to wait until they have a DDFT tear in their foot. Then you're way behind, right? That we need to readjust those scapulas and figure out why did this one get adhered to the body in the first place? Because it normally isn't the painful one. Like if I palpate a horse, the scapula that is stuck to midline is not the painful one. The bulged one is the painful one all day long because they use it. It bears more weight. It gets really sore. but the stuck one is actually where the problem began. And I don't think they're ever catastrophic injuries. Like sometimes we do. We have horses that they did the split, they came up lame, all right, and now this is where we're at. But most of these horses, I don't think actually do that. I think they sleep funny in their stall one night. Their lower neck hurts them, their shoulder hurts them, so they do this for the day, and then it gets stuck. And nobody notices because there's such a small, minute change. And horses are so amazingly stoic because they're a prey animal. They don't show you that they have a kink in their neck. They just sit like this. If I sleep wrong and have a kink in my neck and want to wake up like this, I spend the whole next day doing this all day, right? I might go to my body worker, or I sit here and rub it and I work it out and I come back to neutral. Horses don't do that. They go, oh, my neck hurts. Let me throw my shoulder out. And then they just go there. And that I don't think most of the time they're these catastrophic injuries. They're these micro injuries that didn't get addressed. And then the cascade is set off of dysfunction.
And what can we do as riders, as trainers, to help these horses?
First of all, notice. I think sometimes and I for sure was this way. I had a lame horse. He was my personal horse that I could not get sound. I could not figure out how to get him sound. I took him to other sports medicine vets. I was a sports medicine vet for several years before I had him. I was not new to this. And no matter what I did, he drug a hind leg, was lame as almighty get out, and nothing ever came. And that's really where I went down this path, and I found Dr. DeClue when I called her, and I tried to have her come train me, and here we are years later. But it was noticing. So the first time she came to me, I called her because he was crippled, and he walked out of the stall, and she was like, "Oh," and I was like, "What? What just happened?" Because she's very dramatic, and so she was like, I mean, did you hear him walk out of the stall?" And I was like, "No." And she's like, "Listen to him walk. Dun, dun, boom, dun, dun, boom." I mean, subtle. And I was like, "Oh, yeah, he does land really heavy on his left front." And I'm like, "Well, that makes sense. He's laying on his right hind." And she was like, but that's where you have to notice things. And when she started to reiterate that to me, we become blind to a lot of things because they're so common, right? We don't pay attention to the fact that they have a toe drag or a toe tick behind, because lots of horses have that. And so our eye gets dulled to that. And when you start refocusing yourself and going, you know what, I am going to listen to my horse walk down that aisleway, not just for a loose shoe, but do they land lateral medial? Do they land toe heel? And you start kind of retraining yourself to those very small differences and cataloging them. Then you can be set up for success. So then you don't go, how did I get here? You can go, okay, September 8th, I noticed for the first time ever he stood parked out. Now I'm in January and now I have a proximal hind suspensory issue. Okay, let's kind of go down this path. And I think owners are way more capable than we give them credit for. That if you notice that your horse always eats hay with its left front forward, well, maybe you should start trying to retrain it to eat hay with its right front forward and do little pull work. And little changes can make huge differences, especially when you're not extremely dysfunctional. When you're a really functioning horse for what level you want to do with them, and you pick up on something small and you go, wow, today your scapula is more asymmetric than I remember it being. Let me do stretches today. Let me ride you bareback and work on suppling and figure out where you're stuck today, or give you some Robaxin or Methocarb because you just seem a little off today. I think if we started to do those little things, things wouldn't spiral out of control. And I think owners really need to feel empowered that they do know their horses.
Yeah.
I have owners come with notebooks to me and they're like, please don't think I'm crazy. I never think you're crazy because you know your horse way better than I do.
Yeah.
I might have training and education, but you know your horse and you know that that's now not normal. And I think owners have felt disempowered by the veterinary community for some time. I think body workers have felt that way. And rightfully so. Sometimes you don't have training and education that veterinarians do, or body workers might not, but everybody has something to bring to the table. And if we all started to listen to each other and talk to each other more, I think we would get way farther ahead. That I've never ridden your horse. I don't know what it feels like in its left lead canter. So you need to explain that to me. And then it's my job to figure out what that means.
And
So that's what I would say is worse when I saddle it, but like that's fine. It's not fine. Like it actually shouldn't be girthy, and it shouldn't, when you tack it up, stretch, or it shouldn't do some things that are pretty actually common behaviors that people then don't realize is actually dysfunction.
So at what point, or is a behavioral problem always a pain response?
It's a good question. I vote yes in a large majority of the findings. I will save some caveats for some horses are more difficult than others naturally. In the same way that we all are, right? That some people are way more easygoing about things, other people are not. Like it, so they all have their individual temperaments, but I would say certain behaviors are not. Pinning their ears, biting at things, flinching away when you do something, becoming disengaged with you when they used to be, bucking and rearing under saddle, especially a horse that in theory is trained, right? Not a colt you're breaking out, but a riding horse that's now suddenly bucking. They don't just do that to do that. Like I think their horses are actually the other end of the spectrum, that they tolerate way more than they should from us. And by the time they're bucking or swishing their tail or pinning their ears under saddle, like they're actually quite painful because innately they're designed to hide pain. They're a prey animal. And so I think by the time we see these riding pain, you know, I will always give Sue Dyson credit for her ethograms. I think they're amazing. I think she's really changing a lot on what we understand. But if we go, no, it doesn't just swish its tail at you because it's a mare, like that's actually a painful response in a horse. Now, I will say some of my elite professional horses are very difficult horses. And that's what makes them exceptional. They have a lot of grit, they have a lot of stamina, they have a look at me, center of attention attitude about them. And they can be more difficult to work with because that's who they are. Right? Like and the quarter horses are very different. They shut down. So a quarter horse will come in the barn, exquisitely painful, and stand perfectly still with its head straight and not look at you. That's where their coping mechanism is. Where a thoroughbred, you touch and it's like leaping, and there's just they're a different beast. And I don't know that one is necessarily more painful than the other. It's just how they express it sometimes is more obvious than others.
And are there specific, like, I'm with my horse day to day, and that horse may have come to me already. I agree that girthiness is not normal, and I kind of get on my high horse with girthiness because I, for the most part, also don't really think it's ulcers. Think ulcers can develop.
I think it's actually rarely ulcers.
Yeah, like I think, okay, your horse probably has a really weak thoracic sling, has probably had a bad fitting saddle. Like it, we don't need to keep using omeprazole. Let's look at these other things. But when you are with them day to day, you do almost become a little, unless you're very conscious about it. Okay, I accept you for who you are. You're always an asshole on the cross ties. You're always, this way or that way. And are there certain things that, like, does bucking always equal a back problem? Or, like, does rearing always, like, is there...
I think a few things do. I think, so here's a good example. People will call and say, my horse tucked underneath of me and bolted forward. It comes out of nowhere. It acts like something just jumped on it and it launches itself forward. That for me is always sciatica. Always. Because you've ever stings you, and what do? You tuck your pelvis and go, oh, what was that? Horses will do the exact same thing when their sciatic nerves become painful. That's a really common one for me. Bucking is a little bit tricky because I think that is a little bit of their nature, right? It's like when you're breaking out a horse, some horses bolt, some rear, some buck.
Mm-hmm.
And it's whatever that expression of pain is that they choose. That I don't think it's as necessarily specific. If a horse is bucking, I don't immediately go, wow, it has kissing spines. Like that doesn't do that for me. There's a couple things that do. Horses that won't go forward, shoulder girdle, thoracic sling all day long. Their stay apparatus gets froze. It is too painful to go forward. They can't go forward with their neck in a certain position. It is something is wrong in that thoracic sling, shoulder girdle region. Period. I don't know what it is, but something is wrong. So there is a few things that I think have pretty significant, but like if your horse rears or bucks, both could be back problems. Both could be not back problems. Like there is some, but not always. It's that gray zone that is pretty much girthiness is never normal, period. Your horse should not flinch when you put a saddle on it, ever. That is not acceptable to me. Like, I don't love buttoning my pants, but I don't cringe when I do it, you know? And so, and I agree. I think it's actually rarely ulcers because that doesn't make sense.
Yeah.
Their stomach is not there, first of all.
Yeah.
They have lots of ribs and nerves that are right there and really painful. We don't appreciate or recognize sternum pain in horses. I think a lot of horses actually have significant sternum pain, particularly horses that have collapsed into the ground, whether they are sleep deprived and collapsing, whether they were in an accident and crashed, because the sternum is so vulnerable to damage that it actually becomes pretty painful to them. And then you put a corset around. There's a pretty long list for me for girthiness. And to be honest, ulcers tends to be last, partially also because by the time a horse comes to me, somebody scoped it.
Yeah.
And it either doesn't have ulcers or it has ulcers no matter what they do. Well, if it has ulcers no matter what you do, it has pain.
Yeah. So are we like doomed as a horse industry? Or like,
to some extent, we have done damage that will take us a very long time to undo. ECVM is a good example of that.
Okay, cool.
ECVM we have bred into. I have Sharon Davis here next week, knee cropsing a bunch of horses with us. We do them pretty frequently. I probably knee cropsied more ECVM horses than anybody.
One of my notes was that you did an educational weekend, so I was like, we gotta talk about ECVM.
We do. So that we have bred in until we get a genetic test, we are stuck, because the inkling is that is recessive, and that because you can have two normal parents produce an ECM foal. And so right now there is no good way to manage breeding programs to eliminate it. If it is truly a single recessive gene, it will be extremely easy to breed out. It will just be like HYPP in the core horses, where we then genotype all of them. If they're carriers, you can't breed carrier to carrier, no problem. And we can breed it out probably very fast.
Yeah.
When I talked to Sharon a couple of weeks ago, she feels like it's almost in 20 to 30% of horses at this moment. Which I would probably agree with. I see a fair amount of it. Some clinical, some not. I don't doom a horse because it has ECVM. I read the horse that's in front of me, not the x-rays.
And could you just, what is ECVM?
So it's a malformation of the lower vertebrae in the neck. So it's the lower cervical vertebrae have a malformation. It can be on C6 and C7, just C6, just one side or two side. And the interesting piece is that some of these horses also have thoracic malformations. So T1 and T2 might be malformed. They might be missing a rib. They might have fused ribs. And then the musculature that is all associated with that also becomes deformed in this same aspect. And so scalenus might be malformed. The thoracic inlets sometimes are malformed. And so embryologically that, neck to thorax junction is not normal. And so, which is why I think you have to read the horse. Some of these horses have very mild actual changes, and for their jobs, they're extremely functional and don't seem to present any pain. And other horses, it's catastrophic for. And so that is I think that we have kind of doomed ourselves for at this current moment. I think we can get ourselves out of it pretty fast, but at the current rate, we're stuck there. We bred out the nuchal ligament into the lower neck because we wanted more flexible, more big moving dressage horses. Right. And so now they don't have a nuchal ligament. Well, now they don't have neck stability. So pretty much all horses have lower neck arthritis at this current moment.
Interesting. And that's the ligament that runs like kind of in the middle bottom of their neck.
Yeah, so there's one part that runs from the skull kind of to the withers, and it's this tight band, and it's responsible for quickly elevating a horse's neck, right, from grazing. It's part of this stay apparatus. It's what helps a horse sleep standing. And then there is a secondary portion to it that actually goes and attaches to the vertebrae of the cervical column. And again, helps with neck stabilization and support. And it now only attaches to about C4, sometimes C5, C6, and C7. No. And so that's why when people go, well, I'm like, yes, because they all pretty much do at this point, sadly. Like, we've just done that. The Western industry and the quarter horses have really bred in some pretty bad arthritis into joints for quite some time, so that we're going to be stuck with. The upswing of that is, I think the culture of the horse industry is in a really pivotal point to change. I think owners, I think trainers to some extent want something different. I think, at least from my perspective, I see a huge shift in what was acceptable 5 or 10 years ago. People are starting to wake up to and go, no, like this isn't okay. I think equine welfare is being more looked at. Social licensing and our ability to use these horses for our pleasure and our sports is being looked at. And so I actually think with everything we have going on, I think we're actually at a really good place. I think in 10 years, we will be shocked at the advancements we've both made in our way we deal with sport horses, as well as the overall culture around it, that people are demanding better and wanting better for their horses and are willing to do some education behind that. And that's where you see the explosion of body workers and all of the non-veterinarian equine professionals, is because veterinarians didn't solve their problems, and so they went searching somewhere else. And you have this explosion. And so you had that explosion with a range of education classes. And now you have some veterinarians coming on and going, you know what, like, it might not always be the foot, the shoulder might actually be a problem, even if we can't image it. And that is really starting to shift. And so I think in a few years, we'll actually be in a much better place. At least that's my hope. That's what I work for. Some of it, we're going to have to live with the consequences of our choices.
And
if the racing industry wants to change, we will always have off the track thoroughbreds with problems.
Yeah.
And the problem is the people that want to change the racing industry don't support and fund the racing industry.
Yeah, exactly.
So real change is really difficult. Show horses are different. Owners can demand that their horses have better care. The thoroughbred industry, you can't change for that because those owners don't care, for better lack of a term, the life that their horse is having at that time. So I think that industry will be the longest to ever change. Just as
and you mentioned the explosion of body workers. Can we just quickly get into what is fascia? Because I genuinely do not hear a lot of vets talk about fascia.
So you probably won't hear a lot of vets talk about fascia because we don't learn about it. I mean, I didn't graduate school that long ago. I graduated in 2016. And I can promise you I was never taught about it in vet school. And human medicine is really kind of new to fascia. I mean, they're significantly more along than we are, but in the scheme of medicine, it is a newly recognized category. So fascia is your connective tissue that is really the matrix of your body. It is what allows your brain to know where you are in space. It allows your body to connect and work together as a functional unit. It provides compression for your muscles, right? So muscles function better when they have an outer surrounding to contract against.
Mm.
And so it provides some degree of that. It is important for healing. It is important for the skin to glide along. It is essentially what your thoracic sling is made of, right? Because horses don't
Mm.
have a clavicle. So it's this huge wad of fascia that sits under there that
Oh,
protects the
interesting.
nerves from getting impinged. And it is the most neurosensitive part of your body. So me stimulating your fascia is extremely more painful than if I cut your leg. And so that is the hard part of it, is it's kind of this aloof, massively important organ system. It's kind of what it is that we haven't appreciated and is difficult to appreciate
Mm.
because very few people are talented or trained or skilled enough to feel and manipulate fascia,
Mhm.
human or horse. And so again, one of those topics that I think in 5 years will shockingly be farther along, that we can start pulling from human medicine and really trying to do myofascial work in horses in a really good way. I just hired another veterinarian. She's coming from California, and that was a big conversation that we had was, should we be dry needling these horses? Should
Mhm.
we be manipulating fascia and finding fascial restrictions and blading them and all of those things? And that's really where I hope some of our future endeavors go with. There's a ton of human studies on thoracic fascia being a huge source for back pain in people, and that they realize back surgeries are not really all that helpful in people. We'll
Mhm.
get there in horses, but in humans, they've started to realize that you, fixing the back and the arthritis in the back is actually not what clinically causes people pain. That the fascia being damaged and losing its ability to glide and slide and
Mhm.
having scar tissue is actually what's painful. And they're doing some pretty cool work with ultrasound and measuring fascial planes and
Interesting.
those types of things, which is what we've tried to be doing with our necropsies. So we will ultrasound and measure the thoracolumbar fascia, and then when we necropsy them, we can compare and
Mhm.
decide how accurate our ultrasound is, and can we evaluate quality with ultrasound. And those are the types of things that I think we're going to have to tease out a little bit. It is for sure not my specific area of expertise or interest. Julie, who helped me start this company, she loves fascia.
Mhm.
She is my person that will skin these horses and
Yeah.
meticulously look for their fascia. She loves it.
Mhm.
I'm like a big structure kind of person.
Yeah.
Like I want to see what I can inject and where are the nerves and like, because that's
Mhm.
just how my brain works. But again, another area that I think will make significant improvement in the next 5 to 10 years in the horse world, that we could have a competing horse and provide them some pain relief by fascial simulation and things like that.
And, um, only because 'cause it's been brought up a few times is kissing spine. I remember,
Sure.
like, it was seldom, you know, 20 years ago that I heard of a horse with kissing
Yeah.
spine. And now it's gotten
Yeah.
to the point where literally any horse I get in my barn, I assume they have it.
Yeah.
And, um, I read something that kissing spine isn't necessarily caused by it was this thoroughbred article that was because the whole thing is, are thoroughbreds getting kissing spine because they're getting started at such a young age? And this article basically talked about how kissing spine is actually the result of tension in the back, creating the spines to touch. Is that related to fascia, or is that just like they're young, so they're gonna tense up again? Like, what is the mechanism there?
So unfortunately, kissing spine, it's my favorite thing by
Mm.
far, because I find it
Yeah.
fascinating just as a whole encompassing. But it is too multifactorial. Number one, we know there's a genetic component to this.
Mm.
Um, which makes sense, right? Because your genetics determine your form and your function. And so thoroughbreds, right, have longer top lines to allow for longer strides, and they
Mhm.
tend to be more predisposed to kissing spine because of the way their actual structure is made up. They're already dealt that deck of cards before
Yeah.
anybody sits on them. And I'm fairly certain, and I'd have to go back and find it, but I'm fairly certain I read a paper and it talked about x-raying yearling thoroughbreds before they've ever been sat on, and a high percentage have kissing spine.
Mhm.
So that is where it became kind of like, okay, well, obviously we're breeding it into these horses.
Mhm.
So I think that is part of it. Number two is saddle fit. Our saddle fit industry has really, I think, regressed in the past few years instead of in advance. We've focused too much on rider comfort and not enough about
Mhm.
equine anatomy and biomechanics and how we should fit a saddle. And that actually saddle choice is significantly less than people think, because most of the big brands are actually the exact same tree. And so that you might think you're buying all these different saddles, but functionally they're exactly the same.
Mhm.
So I think that is part of it. And I think how we train horses. I think in today's world, we're really impatient,
Mhm.
right? So we ask a horse to do something significantly faster than we should.
Mhm.
And it is discipline. So you see in Western horses, I treat a fair amount of quarter horses. And so in that world, kissing spine is not that common.
Mhm.
It is more common than it was,
Mhm.
right? Than it used to be, but significantly, and I'd have to pull data, significantly less common in a Western horse or a quarter horse than in any other breed.
Mhm.
And I think the big difference there is two. Number one, they're ridden in Western saddles, not English saddles. And
Mhm.
number horse or stock horse, so you can include paints in it, of any variety, is that from the time they are 2-year-olds and first get sat on, they are asked to lift their back and sit back on their haunches.
Mhm.
Like the first few rides, they're sitting on these things and backing them, sitting on them and backing them
Yeah.
extremely rapidly. And that they actually ask for a engagement of the back and a tuck of the hindquarters far before the English disciplines do, right? They teach
Mhm.
forward and walk
Yeah.
and trot and on a loose rein, and they do a lot of forward in their training before
Mhm.
they ask for collection. And so they actually, their body sets into a pattern long before people realize it has. Now, the flip side is there. Quarter horses lose their flexibility significantly faster.
Mhm.
They get very rigid in their bodies. Their muscles become too hypertrophied and too stuck, whereas English disciplines to retain flexibility a lot longer. Like the coin has its problems. But
Mhm.
in terms of kissing spines, I think a lot of it is you're sitting on an ill-muscled back horse, and you're
Mhm.
just asking them to walk. Because riders, the average rider today is significantly less educated than the rider was some time ago, and so I could go to any horse show. The bulk of what I see, not one of the horses is actually using their
Yeah.
backs. So of course they have kissing spines. Their
Yeah.
back is dropped the entire
Yeah.
time these people ride them. And so I think that's part of it. And we're just better at diagnosing it, right?
Yeah.
20 years ago, we didn't have the average equine vet didn't have an x-ray to take a back film
Yeah.
with.
Yeah.
They might have been there and we just weren't
Mhm.
knowing.
Yeah. So that's as we wind down here, the competition setting, I'm an upper level eventer, but I feel very fortunate that I didn't make it into the upper levels until kind of recently. So I've had to educate myself a lot. Um, and I the amount of horses that I see at events in not the lower levels with an adult amateur rider, not coming through its back, braced through its neck is alarming. And they're these freak movers, so they still get
And lame
rewarded
horses.
by judges. How
And they're lame. And
Yeah,
I'm not
yeah,
talking about just eventing. They did a recent study at FEI horses, eventing, jumping, and dressage. They were all lame.
damn.
All of them. Right?
Yeah,
And I mean, I watched a dressage the other day down at Klibble. A horse scored a 92 that was visibly a 2 out of 5 on its right
yeah,
foot.
yeah.
right? And so that becomes a problem, particularly to owners that are paying a professional to ride,
Hmm.
right? Look, we're talking about like the elite kind
Yeah.
of
Yeah.
group of this bundle that fund and own these horses but don't
Hmm.
ride them, that don't know enough, because if the trainer says your horse is fine, if the vet says your horse is fine, and the judge just gave it a great
Yes.
score, it's fine.
Yeah.
But I think our eyes have become that dull that like we don't realize. I watched I forget whether it was Burley or one of the other big events I sat and watched, and I'm like, but it's clearly painful.
Yeah.
Like for me, it's clearly painful going around cross country, or it cannot get a lead change,
Hmm.
or it cannot do certain things. And like I I think we've just figured out that because they can doesn't mean that they should.
Hmm.
Just because you can go around an advanced course doesn't mean you should.
Yeah.
And it's not only dangerous to the horse, it's unsafe for the person. That's what eventing is crazy to me, for the record. Not because I can't appreciate it, but like I'm boring and want to ride a Western pleasure horse. So like the thought of jumping in an inanimate object that fast is mind blowing to me, let alone on a horse that periodically trips on its left front because its brachial plexus gets
Mm.
impinged consistently throughout the event.
Mm.
All it is one micro movement away from a
Yeah.
rotation fall
Yeah.
at that point. And so I think that's what we need to get better about. And that's where I really love Sue Dyson's ethogram, because it gives you an objective way that in a professional setting, you could go, hey, by fence 3, by move, whatever,
Hmm.
your horse displayed 10 behavior signs, so you're now carded. You cannot finish your course.
Mm.
And that
Yeah.
we're not waiting for these horses to be lame, that we're actually caring that they go around with their ears pinned the whole time. Like that, it, that is where I think we need to be. And I don't think we need to throw the pendulum so far that we're not competing these horses. I
Yeah.
love
Yeah.
competing horses. I think it is amazing.
Hmm.
And I think sometimes they're going to be uncomfortable because athletes are, and they still
Yes.
love and do their jobs, right? The
100%.
horse that's an upper level eventer does not do that job unless it loves to
Yes.
do that
Yes.
job. A cutting horse does not cut a cow unless it loves to do the job.
Yeah.
A jumper doesn't jump a Grand Prix course unless it loves to do its job. And so I'm not saying they can't be uncomfortable, they won't have problems. It's at least that we're recognizing them and we're trying to help them as much
Hmm.
as we can.
Yeah. Oh, amazing. Well, this has been extremely educational. Thank you so much for joining
Yeah,
me. This was great.
absolutely. It's
So,
my pleasure. Happy to do it anytime, because I think the more we get information out there, the more people can feel empowered to go, no, I'm going to keep digging for why my horse is doing this. Even though I've been told it's okay, I'm going to keep digging. I'm going to keep researching. I'm going to keep reading books. I'm going to keep trying to search people out, because I think the more we raise awareness to it, the more we can really increase equine welfare and do the best for them that we owe to them to do, because
oh,
they're amazing.
100%. No, it's
Yeah.
it's such a passion of mine. I had this thoroughbred mare when I was like 15, and I had her for like 3 years, and then randomly one summer, every like 25th step she took was just a little weird. And I took her to 3 different vets, and they were all like, no, there's nothing wrong with her. And I was like, no, I'm telling you. And then
But you
finally, this
knew there
one
was.
poor vet, I made him stand there for like 45 minutes,
Yeah.
and I was like, just wait, you'll see it. I feel it. And
Yeah.
he was the only one that was
Yeah.
like, oh, yeah, there's something going on there. And then, it ended up being lateral collateral ligament inflammation of the coffin bone, this like super obscure thing. But like, we found something. And ever since
Yeah.
then, I've been like, what are they communicate with us. We just need to listen.
All the time. And I think they communicate all the time. And I think in today's world, it just is a whole encompassing how we live today. We don't take a deep breath and pay attention. And horses are subtle creatures,
Mhm.
right? They communicate to each other in a herd all the time. Like if anybody needs a refresher of this, go watch a herd of just horses, right? They talk to each other all the time.
Mhm.
And very rarely is it very loud, right? Very rarely is it somebody chasing somebody off or kicking another one.
Yeah.
But there is always this communication. And that's why I videotape my exams, because they communicate through it. If I graze this rib and you go, that's important, because I don't want to wait until you're biting at me. I don't want to wait until
Yeah.
you're
Yeah.
watching me from the saddle, right? That I view them very much as unheard.
Mhm.
And that by the time they get to me, they are screaming at the top of their lungs because they're fed up with everything. And then you have to peel back what actually hurts and what is just chronic pain and now everything hurts. And
Yeah, yeah,
I think we owe it to them to go back to some basics, go back to basic horsemanship and listen to them. How do they feel when I pick up the foot? If your horse doesn't pick up its feet easily for you, something's wrong. Like
yeah,
they're amenable creatures. They're lovely creatures. Like they don't want to kick at your farrier. That is
yeah,
not normal, you know. And I think we do. We haven't given them a voice in too
mhm.
long, and I think it's time we really do that. I think we have to respect them for the amazing athletes that they are, and that they tolerate us. Like I'm sure half the time they're like, why are they not paying attention? Why do they not see this? Why do they not pay attention? Because we live in such a vocal, loud world that we don't pay attention to them like we should.
Yeah. No, and that's the, you know, when people are like, well, horses are feel animals. You can't teach feel. It's like, no, you 100% can teach feel. You just have to literally relax. Listen to what they are saying.
Yeah, and
They're
be willing.
talking to you.
Just
Like,
be.
yeah,
Just be with them. And I do. I empower. I want owners to always feel empowered. If
yeah,
you think something is wrong, something is wrong.
yeah,
It it is wrong, whether it's like catastrophic wrong or not, right?
yeah,
Or
yeah.
what it is, who knows? But if you know your horse and you know, right? It's just like when your horse is colicking. If your horse comes in and eats every day, and then the one day it doesn't come in, you know.
Mhm.
And if that doesn't question that when you call them about that, but your horse being uncomfortable every 25th step, they're like, it's fine. It jogged and flexed fine.
Yeah, yeah, exactly. Flexed fine.
No, it's
Blocked fine.
not fine.
Yeah,
Like, it's not fine. Something's wrong.
exactly.
So,
Well, again, I am so grateful for this. I'm sure you will be getting texts from me in the future. Please come back on.
you come on whatever topic.
Awesome. Well, thank you so
Yep.
much.
No problem. My pleasure.